So first, I just want to say thank you to everybody who's been coming to conference. We've had a lot of fun in person, and so please keep coming. And then secondly, I just want to say you all have been doing a great job, especially our interns, seniors, of cracking cases. And so I want to get away from that a little bit and sort of talk about other things. And Danny and Amelia can keep doing cases. I'll keep doing them if I come across any interesting ones. And we have a large repository on our YouTube channel, so if you're really hankering for a case to look at, then you can always go on that and find one that's interesting for you. But today I thought we would talk about how to teach learners, and for our learners, sort of what sort of questions you might expect on the rounds and what sorts of teaching you should be getting. So this is geared toward our interns who are quickly becoming seniors and then our senior residents. But really, it can be for anybody who's going to be a fellow or faculty. So I really love this video, and this is the wrong way to teach on rounds. Sorry, there's no sound. So we want to avoid this. We want rounds to be concise but educational, and for you all to be able to make it to conference without feeling like rounds just went to 11:45. I need to call my consult, so I'm not showing up to conference today. And that just detriments your learning, right? So first, what I want to do is we have a lot of senior residents here, a lot of third years and second years. So I wanted to do a quick resident panel. There's a mic there in the middle. Would you guys mind sharing what your experience has been like as teachers on the ward? Was it easy to do? Is it something that somebody taught you how to do, or you just figured out on your own? What's it been like?
I think it's a harder transition than the transition to being an intern or a medical student, because I think your job is a lot less defined. There's not necessarily a right way to do it. And what I did was like reflect on seniors and the attendings that I liked working with them, and that I admired the most, and realized that they were all pretty different. When just trying to model certain behaviors after the people that I feel like I learned about them.
So Sam said that it was a harder transition for her than becoming an intern because the role is less defined. Nobody actually teaches us how to teach, and you're just asked to do it. A lot of the feedback I got in my first few months as a second-year senior was, hey, you're being too much an intern and not being seniorly enough. And what that meant was that they wanted me to teach more and think about the larger picture. And so I wanted to give you some ideas on how to do that today to make that transition easier. Any other comments?
You learn in real time how important the dose and root of administration is for your teaching. So basically, like the amount of stuff that you're trying to cover and like where you're covering it. I think I found like more and more that like at the point of care on rounds, relevant, teaching pearls is probably the most high yield. And there's a time and a place for like a big talk about something, but that's like not even an everyday thing. That's like maybe like a once a week,
Yeah,
mandate.
absolutely, Jason. Yeah, so point of care teaching that's pertinent to the patient you're seeing and keeping it short, making a big impact is key. Something that I fell into was like I ended up doing these chalk talks on rounds, which is inappropriate, but that's all I knew how to do. So I talk about hyponatremia for 15 minutes, and that is a lot of time and unnecessary. So learning when it's appropriate to do these longer talks versus when you should just do a key question and assess the learner. What else? Anything else?
I think like everything you need to, anytime you're talking or trying to teach, you need to kind of know your audience. So like in the beginning, when it's fresh interns, what do interns want to know? They want to know how to not kill anyone, or like when should they call for help. And then when there's new medical students, then it can be even more kind of basic, with smaller teaching points. And I think it was more challenging when later year interns were looking for teaching and you were trying to like find out, figure some more complicated advanced learning to give them.
Learning topics, yep. So teaching to the audience, and we'll talk a little bit about that today. Anything else, Hoda, your second year, how's it been for you?
Yeah, everything that everyone said already. I think, in the beginning it was challenging because I also felt like going into second year, oh my God, there's a lot I don't know, how I'm gonna teach. But then you also realize that one of the third years now, beautifully pointed out, the system has trained us well. We need to just rely on the system and know that it has trained us well. One thing that I recently found challenging was gauging my teaching to different levels. When I have learners, like an intern who is almost a senior now, and what a third year who still has a lot to learn, and how to make rounds not take forever, and also have teaching points for everyone.
Right, yeah, so particularly this time of the year, we have students who have just started their clerkship, but interns who are almost seniors, and so the gap is large, and trying to figure out how do I close that gap for my learners who need basic knowledge versus my interns who need to learn about doc papers and really evidence-based medicine. So we'll talk about that too. Okay. At the end, we'll have a chance for if any other thoughts come up for you all. So I wanted to start with teaching aims and really narrowing the scope of when you should teach. The general guidance that I try to go by is 1 teaching point per patient, and then teaching for about a third of the patients on your team. So try not to make teaching points for every patient. That's going to lengthen your rounds. And so what I generally do is try to stick to this, and then for the rest of the patients, maybe use that feedback talk we did last week and either give the students feedback on their presentation, but then for the plan aspect, just talk to your intern about, hey, this is what we're going to do today, or hey, let's talk later about why for this patient we gave urea versus more fluids for hyponatremia. And so really try to be judicious about in which patients you teach. I usually try to do more teaching for newer patients, so patients who are admitted overnight, patients who are admitted before rounds. They have a lot of learning to do. But again, try to minimize to 1 teaching point or to 1 learner level as opposed to all the learner levels. And you can pick a different set of patients the next day or the same set, but the next day teach the intern something, whereas yesterday you taught the med student. Try to stick to this, and that'll help rounds be more efficient. So then, of course, we've talked about learner levels quite a bit, and so let's talk about that. There are lots of learners on the team, including right now most students and early interns that are coming on the wards soon in July, versus most interns and advanced students, and so we'll go into this. And then, of course, there's yourself as the attending or the fellow, and then the senior resident. So let's see what we should do for most students and some of our early interns. So these learners are in the stage of creating their illness scripts still. They need to see diseases, they need to start learning what they're like, and so your questions to them should be geared toward helping strengthen their illness script. And so all of the questions that are going to be geared toward our students, or at least my suggestion, is for them to be what questions. And so what that means is just asking what. So what is a PE? What does SSTI stand for? And this will help you understand what the knowledge level is of your learner. If they don't know that SSTI is skin and soft tissue infection, then maybe you can't really jump to what dose of cefazolin you want to give that patient if you don't have the basics down of what the disease even is. So start with what questions. If they're really good at these what questions, maybe that learner has a lot of sort of basic knowledge, and you can up it to what if? Well, what if this PE patient were hemodynamically unstable? What would that mean? Or what if this patient had ST elevations as opposed to ST depressions on their EKG? How would that make you more worried, right? So keep it to simpler questions, what if? And that'll help them go from definitions to more critical thinking. And then the last technique you can employ is asking what else. So this will test what is their differential knowledge like and applying context. So what else could this pleuritic chest pain be because the CTP was negative? And so seeing if they're ready to broaden their differential. So if you notice that the learner in their plan section of their presentation didn't really go into differentials, this is one way that you can ask them to talk about their differential or how they arrived at the diagnosis, right? So asking what else. As opposed to the illness script, for your more advanced learners, they're in the process of engaging in clinical reasoning and improving their critical thinking, right? And so for these learners, the questions will be different. The main question that we ask is how, and these are all really management treatment style questions. How would you treat this PE patient? If they mention, oh, I want to put them on rivaroxaban, you can ask, how else can you treat them in the hospital? What are the barriers to that specific treatment that you chose? And to ask a lot of how questions. Then you can get into the why, so you're digging even deeper. Why do we opt for rate control versus rhythm control? Why is COPD treatment 5 days, right? A lot of these things that we know how to do routinely, but we don't ask ourselves, why do I do it this way? And it's a really nice segue into bringing, it should be EBM, evidence-based medicine. And so bringing abstracts and literatures to review on rounds with some of your advanced learners that have now mastered the how and are really looking into the why. What questions do you all have so far on this schema? None? Okay. So then I just have some teaching ideas for you all that you can utilize on the rounds and later in the day. But so the first idea is just to teach with patient media, and this is the easiest thing to do. Pick a patient that has an interesting EKG or an interesting chest X-ray and have your learner read it live on rounds. And you can assess their knowledge of, do they know how to read EKGs? Do they know how to read chest X-rays? And that is an easy learning teaching point that you can make about, hey, this is how we read chest X-rays, or how you can make your better for this patient. You can also do bedside POCUS, great way to teach. At the VA, we have portable ultrasounds, and so I just carry one with my team, and patients that we think have pulmonary edema, we go put an ultrasound probe on them, check out all the B lines that they have, great bedside teaching. And then lastly, of course, imaging, so CT scans, more difficult to read, but can be something you can do with your interns and with your senior residents. The next way that I sometimes like to teach is, you'll notice that sometimes just by sort of serendipity, you'll have groups of patients on your team that are really similar. So you'll have a few patients with cirrhosis or a bunch of patients with diabetes. And so sometimes I make my days a theme. And so you can bundle your learning. And so you can bundle your learning by, say, a diabetes theme, right? And so you can show your learners these groupings of blood glucoses and ask, hey, how would you change their basal insulin based on this blood glucose? Or, hey, here's an image of a retina. What do you think might be the underlying pathology? Diabetic retinopathy. And then we have a DK lecture that Danny did on YouTube, and so you can suggest your learners go and watch that lecture so that they can better take care of this DK patient in front of you. So lots of ways that you can both do teaching on rounds and then have the learner do some self-directed teaching. So imaging, then bundles, then the presentations. And this is something that Jason mentioned. And how can we allow our learners to do some of their own self-teaching? So you can ask the learner to do 2 to 3 minute presentations. These you can do multiple times a week and are doable, and the learner shouldn't take more than 10 minutes to research a topic. And so even with all the shelf studying that you all have to do, you should be able to do this in addition to that or in conjunction with it. And you should just ask them a very simple question like, hey, tomorrow can you tell us about thymoglobulin? It should take 2 to 3 minutes, just educate the team on something rare that you're seeing. Or hey, tomorrow can you tell us about this weird bug that grew on their culture? And we're consulting ID, but we'd like to know more about it, right? So easy teaching. You can also ask the learners to do these 10-minute presentations. And so can you prepare a talk on Wilson's disease, which is something we're working up for this patient, but that urine copper is going to take 3 days. So let us see if there's something else we could be doing in the meantime. And that is something that can come out of a talk that your learner can do. But like Jason said, this isn't something you should expect of them every day. This should be done max once every 2 weeks because they have a lot of other things they are doing outside of the hospital. And also make it pertinent to a patient on the team. Randomly asking somebody to talk about hemochromatosis when you're not worried about that in any of your patients is not going to stick very well. But doing these big talks for something that sticks to a patient on the team will be helpful not only for you, but for the learner as well. And then lastly, for our seniors or interns who have some time in the afternoon, you can do your own chalk talks. And for this, you can use something like TeachIM, which teaches you how to give chalk talks as a resource on the day inpatient month, which can be busy. And so this is a service that you can use to make life easier for yourself instead of coming up with these talks on your own. Okay, and then the last idea I have here is a literature repository. So this is something I started developing as a second year because I found myself like Googling these articles every day, and I'm like, why not just put these in my OneDrive? And so I have different folders for different pathologies. And so I love these to race and affirm. I bring all the time on the rounds because there are tons of patients with AFib and to teach about how we manage that. And so for the interns that are becoming seniors or people who are going to be in their third year soon, I'd really encourage you to start making a lit repository and use it often to teach some of your advanced learners. And then the last thing really is that learning should be fun. So if there are days where you just got 4 overnight admissions, you know you're going to be really busy, you don't want rounds to go long or feel tiring, you can do really small things. And so sometimes what I did when I was tired or had a big team to take care of was bring an image from the NEJM Image Challenge. And at the beginning of rounds, you just discuss this image as a team and then know that the rest of the learning on rounds is going to be sparse because we have a busy day taking care of patients. You can also use mix-app questions. And so for those of you who have mix-app, you can just bring in a mix-app question that's pertinent to any of the patients on your team. And go through those. Sometimes I would like group them so they're similar questions, but see how they're slightly different. And this could be an easy way to learn, but doesn't take a lot of time. And then for a bonus, to think about your own learning, and our learners can do this too, but how do I teach myself day to day? That's an easy way to do it. And the one trick is asking your consultants to explain their clinical reasoning. Because a lot of times consultants on the phone will be like, hey, do this, and then hang up. Wait, don't let them hang up. Ask them, hey, why didn't you recommend IV levothyroxine for my patient who had a TSH of 85? And this just happened to me when I was attending 2 weeks ago. And the endocrinology fellow explained to us, here are the reasons we're doing just PO for this patient. Another example of when I was a second year at the VA, an EP doc after ablation kept asking me to start PPIs on the patients, and I didn't really understand why. And so after the third time this happened, I was like, wait a minute, can you just like for 2 minutes explain to me why we're ordering this PPI, and then learned about the atrial esophageal fistula that can happen after these ablation patients. And so sometimes you can use your consultants to explain their advanced clinical reasoning, and then you can make better decisions in the future. So the next time I see a patient with a really high TSH, but no evidence of mixed edema coma, I'm not even going to wonder whether I should do IV levothyroxine. I'm just going to start them on PO. Okay, and so I just wanted to open it up once again to see if there are any other effective teaching techniques that you've appreciated on rounds that I didn't cover today. And if not, you all can have a good rest of your day.
I think one thing is that setting advisory that was helpful, especially early second year when you have that feeling of like, how am I supposed to teach anyone? I feel like I don't know anything, is simply explaining your clinical reasoning and like how you interpret what's going on with the patient is educational to learners who are not experienced with you. Even if you don't feel like you have a specific teaching point, just explaining how you think is properly teaching point.
Good. So Sam, one of our future chiefs, suggested that just simply explaining your clinical reasoning as an early second year is a great learning opportunity for the rest of your team. So do that, and maybe through it, your attending can correct you too if your clinical reasoning was a little bit off. And so both a learning and a teaching opportunity.
I think, especially when you're working with like more advanced learners and like end of year interns, you're gonna be doing a lot of teaching that is more stylistic rather than like, you know, this right way to do things. So I think making sure that you explain, like, this is stylistic, but this is why it is my style. Because that's how you help people kind of develop their own style. And the other thing, I don't know if this question is what this question is getting to, but being really intentional about who you're asking the question to. And if you're gonna jump around between different people, it's trying to avoid like asking one person, them not knowing, and then shifting to like a peer, you know, so that they can answer it. You know, when you have people at different levels, it's good to kind of like focus in or maybe go up the chain with your questioning rather than
A competition,
Yeah,
which is not a
exactly.
safe learning environment, in my opinion. So Jason is suggesting, don't make third years compete amongst themselves. If one third year didn't know the answer, maybe go to the AI or go to the intern, and just put it up the chain. Because we want them to help each other succeed and not compete. Well, thank you. I hope that was a little bit helpful. I wish that I had had this talk when I was becoming a second year, just for like a little bit of information on what to do and how to teach. So I'll put this up on YouTube and you guys can, review those slides we had of what questions to ask our junior learners versus our more advanced learners. Thank you.